They're tracking the numbers closely tonight as Canada hits another milestone. There are now more than 50,000 confirmed cases of COVID-19 across the country. More than 2,800 people have died. So far today, more than 1,500 new cases have been confirmed. Most of them are in Ontario and Quebec. In Atlantic Canada, there have been no new cases in New Brunswick, for example, for more than a week. Newfoundland and Labrador has reported just 2 new cases in the last week. Those numbers are a sign physical distancing is working, but it doesn't mean the virus is gone, just that we have to learn to live with it. Eric Sorensen takes us through the latest federal projections.
The spread of the coronavirus is slowing in Canada, and with that growing anticipation, the country is edging towards opening up the economy. The epidemic here has slowed relative to many countries, cases doubling just every 16 days now. And across the country, there are essentially regional epidemics. The curve has flattened for several small provinces, and the growth has leveled off, even in Quebec and Ontario. Health officials now looking at measures to ease restrictions.
When the time is right for each jurisdiction, what some of those initial measures could be in terms of easing back some of those public health measures.
The message has shifted from ominous 3 weeks ago.
We're at a fork in the road between the best and the worst possible outcomes.
To cautiously optimistic today.
You already know that if your neighborhood doesn't have new cases, if your province is flattening the curve, this is a good sign.
Canada is gradually containing the epidemic. Weeks ago, each infected Canadian was infecting at least 2 other people. That was exponential growth. That number has now been brought down to just over 1 other person. And if you can bring it below 1, the epidemic will die out. Now, we're familiar with modeling scenarios in a worst case, massive infections. With some controls, it's a little bit better. And with the controls we've taken, isolation and distancing, we're within a curve with far fewer cases. But don't expect that curve to flatten out entirely. What with getting back to somewhat normal life, you can expect to see some waves in the fall and possibly the winter.
It's not that after the first wave we're in the clear. We're anticipating a second, third, who knows how many waves, but we're trying to find a manageable level in terms of, as you say, opening up the economy.
It also means vulnerable populations, older and in group settings, will continue to be at risk. Where ages are available, Canadians over 60 account for 95% of COVID-19 deaths. So provinces have to be prepared to pull back again if necessary.
You have to have your finger over the cancel button at all times to have people rush back inside. Because the second you detect a signal of an outbreak, you've got to swoop in with enormous public health infrastructure.
For now, we're not through the first wave. Ottawa's model suggests by this time next week, an additional 500 to 1,100 Canadians will have died from COVID-19. Eric Sorensen, Global News, Toronto.